let's talk cesareans. We know the cesarean rate in the UK is increasing. If you look at any trusts, and that's any of the local hospitals around us, their cesarean rates are somewhere around 50%. So in fact, in some cases, it can even be higher than 50%. So it is really important to understand what is involved in a cesarean, because more and more women are delivering their babies via cesarean. Now, as I mentioned in the course the other night, one of the reasons we're seeing that cesarean rates are increasing is that women are electing to have cesareans. So historically, trying to elect for a cesarean unless you had a medical condition was actually very difficult. And in some trusts, particularly Oxfordshire as an example, if you were electing for cesarean without a medical condition, then you would have to move trusts to be able to get one. Whereas now, we now understand that women should have complete autonomy and choice over their bodies, and for some women, the right choice for them, whether that is from a physical or emotional perspective, is to have an elective cesarean. The other reason, though, we're seeing cesarean rates increasing is because we're also seeing the increase of induction, and we know that induction puts a lot of stress on the body. It can put stress onto baby, which means that babies sometimes have to be born via a cesarean or assisted delivery. So we're seeing both of those increasing. So it is important to understand what is involved in a cesarean, and also what the differences are between a planned and an emergency. Now, I find the term emergency cesarean a little bit scary, and actually in most cases, an emergency cesarean is not the big emergency that it's made out to be. So let's just start with a planned or an elective cesarean. So that basically means that you and your consultant, whoever's managing your care, have decided that the right course of action for you is to have an elective cesarean. So it's planned. Generally, it's done around 39 weeks. Sometimes it can be done a little bit earlier, but 39 weeks is often where they like to perform the cesarean. And sometimes it can be a little bit later. So for some women, you might have that conversation where you say, well, let's get to 40 weeks and see where we're at. The longer that baby can stay in the uterus, the better, because those last few weeks is where baby puts on all the additional fat stores, and they store their iron and everything in there. And of course, it gives their lungs a chance to completely fully develop. So the longer we wait, the better. But generally, a planned cesarean will be done between 39 and 40 weeks to avoid you going into labour. Now, if you have got a planned cesarean and you did go into labour, that's okay. Depending on the reason for your cesarean, they may say to you, why don't we just carry on in labour and see where you go? Or they can stop your labour and still perform the elective. So with an elective, normally you are invited into hospital at a set time. In most hospitals, it's quite early on, but it depends on the size of the hospital. Sometimes they might have a morning list and an afternoon list. So you'll be invited in at a set time. You'll be taken onto the antenatal ward. They will prepare you for surgery, so give you all the stuff you need, your gown, socks, and talk you through the process. And at that point, you will often meet the anaesthetist, who will come and talk you through all of exactly what's going to happen. The anaesthetist actually is kind of what I feel is one of the unsung heroes actually in labour, in a cesarean, because they're the person that is not only responsible for your care. So one of the side effects of the anaesthetic is low blood pressure. And often women can sometimes feel a bit sick. So they will be there just making sure that all of your vitals or your stats are all okay. But they're also the person that will be talking you through and reassuring you and helping you to stay calm. So the anaesthetists have actually a really important role to play in a cesarean. So they'll come and visit you, and you may also meet with the obstetrician, and you may also meet with someone called a theatre nurse. And a theatre nurse is somebody that is responsible for you from the time you go into surgery into the recovery ward, and then you are no longer in their care once you've left the recovery ward. They're also in the theatre, making sure that the obstetrician has everything they need, the anaesthetist has everything they need, and that you are okay. And then you'll be taken down to theatre at some point. And with an elective cesarean, it is important to mention that even though you have got a time slot, depending on the size of the hospital, if they have an emergency that comes in, you may get bumped a little bit. So do expect that you could have to wait around for a little while. In a bigger hospital, generally they'll have a theatre that is solely for emergencies, and then they'll have a theatre that's solely for planned. But of course, that also is dependent on obstetricians and their availability. So just take some stuff with you and just prepare for yourself that you might need to have a little bit of a wait. Then you'll go down to theatre, and in most cases, an elective cesarean will be performed via a spinal anaesthetic, which is similar to an epidural, and we'll talk more about pain relief choices in our week 2 class. But a spinal basically is going to numb everything from your bump downwards, so you'll have no feeling in your legs. It's administered by your anaesthetist, and they basically put it into the spine, hence the term spinal block. And they'll check that the spinal is working by spraying some cold water on your legs, just to make sure that you can't feel that. In most cases, the spinal is really effective, but there are risks to be considered. Around 1 in 50 spinals are not effective. And if it doesn't work, then the alternative will be for you to have a general anaesthetic. Now, if you're having a spinal, your partner is generally able to come into the room with you. In some trusts, I find they ask the partners to stay outside until you have the spinal inserted, but a lot of trusts now are inviting partners in at this point as well. And partners can stay with you throughout the cesarean as long as you're having a spinal. If you have a general anaesthetic, partners will be asked to leave, unfortunately. So with a cesarean, you'll have no less than 7 people in the theatre with you. So it can be a little bit overwhelming. It can feel a little bit scary that all of these people are there, but most of them you would have met before. Hopefully they would have come and introduced themselves to you. And if you haven't met them, they will introduce themselves to you whilst they're in the room. So normally you'll have 2 obstetricians. They're going to be responsible, of course, for the incision and delivering baby. You'll have an anaesthetist and an anaesthetist assistant. They're going to be up by your head, talking to you, checking all your vitals, as I mentioned before. You'll have a midwife. So normally your midwife will be the person that will meet you in the ward and will come with you into theatre. They're there to make sure that you're okay. They're also there to make sure that baby is okay when they're born. There's also a paediatrician present. They normally stand to the back of the room near the resuscitator. They're just there if there is any concerns over baby, but generally they're just kind of tucked away, hopefully you're not going to need them. If there was any concerns over baby's health, then the paediatrician, the midwife, would be responsible for that. And then you'll have a theatre nurse and a theatre nurse assistant also in theatre with you. So these people will all be around explaining what they're doing and talking you through the process. So once the spinal has worked, then they'll make the incision, and basically they cut through all the different layers of the skin and the fat tissues, and they'll pull your abdominal muscles back to access the uterus, and then they'll make a small incision basically just along the bikini line to remove baby. And then once baby is born, which is normally around 15 minutes after the incision has been made, or really 15 minutes after you've arrived in theatre, to be honest, it's a very quick process. Baby will be passed to you for skin-to-skin contact. And that's a really important part of the cesarean process. Years ago, babies used to be taken off, swaddled up and given back to mum, but now they place baby onto your chest unless you request otherwise. The biggest part of the whole procedure, really, the longest part, I should say, is stitching you back up again, and that can take around 45 minutes. Once that's all been done, you will then be taken to the recovery ward. Now, this varies from hospital to hospital, how long you stay in the recovery ward. Some, it can be until the spinal has worn off, which is around 5 to 6 hours. In other units, they will take you down to the postnatal ward much sooner, and then you'll recover there. So it's very much dependent on where you're birthing your baby. Normally with a cesarean, you can expect to stay overnight for at least 1 night, and then you'll be sent home normally the day after. And the key thing with a cesarean recovery is just to try and be as mobile as possible, but obviously also respecting the fact that you've just had major abdominal surgery. So it's important to rest and recover and nourish your body. But often women say to me that when they started moving around, it actually felt better. So that is a planned cesarean. The difference between a planned and an emergency cesarean is simply that it wasn't planned. And there's different categories of cesareans. So first one is a category 1, and this is what would be an absolute emergency. These are very rare. Very rarely do I come across anybody that's had a category 1 cesarean. So category 1 cesarean, I'm just going to kind of read out what the definition is basically when we would expect the section to be carried out within 30 minutes. But in fact, it is normally carried out within about 15 minutes. So this is when we really do need to get baby out. And in this situation, normally you would have to have a general anaesthetic because that is the quickest and easiest way to deliver baby. As I said, very rare. So category 1, partners will not be allowed into the theatre if you are having a general anaesthetic. And actually normally that's because there is some concerns over mum or baby's health at that point. The most common type of caesarean is a category 2. So a category 2 is carried out between 30 to 60 minutes of decision, but is not deemed particularly urgent. So, we know that baby needs to be born, maybe mum's getting tired, maybe baby is starting to show some early signs of distress. So we know that baby needs to be born, but we've got a little bit of time just to get everything sorted, get your head in the game, kind of come to terms with the fact that this is what's happening, and then you'll be taken down to theatre. Partners can be present, spinals are normally used at this point, so that's all great. And then we have the category 3 caesarean. So this again is an emergency caesarean, but this one is normally carried out at a time that is deemed appropriate for you and the theatre staff. So it's not urgent. We just know actually now this is the safest way to deliver baby. So for an example, I had a client, my very first doula client actually, and bless her, she laboured for a little while, and her labour just wasn't progressing. Looking back now, I'm pretty confident her baby just was not in the right position, and it didn't matter what we did. I tried every trick in my doula book to try and get this baby to move, and just nothing was working. She'd started off at a midwife-led unit, transferred over into the main labour ward of the hospital, the closest hospital. Baby was fine, baby was doing okay, but just labour just wasn't moving forward. So they gave her the choice of an induction, which actually an induction probably wouldn't have made any difference if baby wasn't in the right position, or that she could have a caesarean. So she elected for a caesarean. We actually just spent the afternoon, it was on a Sunday, it took a few hours for it to come around, and we just spent the afternoon talking, laughing, a few tears. I was able to completely prep her on exactly what was going to happen, and actually it was a really positive experience for her. So yes, it was considered to be an emergency because it wasn't planned, but actually it felt very much like a planned caesarean. And then a category 4 is what we consider to be an elective caesarean. So they're the different categories of caesarean. Now, what are the differences between the two? Well, generally you'll find with an elective caesarean, it's a much calmer experience because of course you haven't laboured, you've made that choice, you know that's what's going to happen, you know what day you're going to have your baby, and you've got time to kind of prepare yourself mentally and physically for that procedure. With an emergency caesarean, quite often you can find that it can feel a little bit more stressful, particularly if you have laboured for some time and maybe the decision has been made because your baby is starting to get tired or distressed. So an emergency can feel a lot more traumatic than an elective, but the most important thing is that all of these things should be done in a very informed, consensual manner. When it comes to breastfeeding, often you might hear that some women struggle with breastfeeding after caesarean. And when we dive into the figures, again, it's normally if a woman has had an emergency caesarean because, of course, she's probably experienced some stress leading up to that procedure. With an elective caesarean, quite often we can see that breastfeeding is normally fine. There's normally no interruptions or disruptions from a planned caesarean. The other thing to also remember with a planned caesarean as well is that you have a little bit more choice and a little bit more input into how you want your caesarean to be. And on the email I send you, there is a link to something called a gentle or a natural caesarean. And over the years, we started to really recognise that a caesarean should be as close to a vaginal delivery as we possibly can make it. And that is incorporating things that can make it a much more positive, empowering experience for you. So things like asking for your music to be played rather than the obstetrician's music to be played. If you don't know what sex you're having, then the obstetrician should let you find out what that is. What if you've had a boy or a girl, rather than the obstetrician telling you. Things like where you have the cannula placed. Quite often we put the cannula on the back of our hand. It could be if you're right-handed, you'd prefer to have the cannula on the left because then that will be less disruptive for feeding. It could be you have the cannula on your elbow so it's not in the way. there's lots of things that you can ask for. You can wear an eye mask if you want to keep it really nice and dim and quiet and calm. You can wear earbuds as well, so you don't hear everything that's going on. So there's a lot more conversations you can have about making it a much more kind of woman-centric experience. You can ask for them to lower the screen as baby's being born, so you can see them being born if you want to. When it comes to an emergency, depending on the time frame, you will have less involvement in what's going to happen. But I always encourage all of my clients to think about preparing 3 birth plans, and we'll talk more about this in week 2. Plan A is your absolutely amazing birth. This is exactly how you want it to be, and that's the one that you hopefully are going to get. Plan B, maybe if something has changed in that plan, so perhaps you're being induced, or maybe the pool isn't available. Plan C might be a cesarean, and that is really important. Just think, okay, if I did have a cesarean, what is important to me? What would I like my cesarean to look like? And we're not hoping that we're going to go there. We're not going to, by talking about it, it's not going to manifest it, it's not going to make it happen. What we're going to do though is be prepared. So if you did have to have that conversation about having a cesarean, rather than thinking, oh my God, we've not discussed this, I don't know what to do, you can go, right, okay, we did have this discussion, here's my plan, and here's what's important to me now. So hopefully that helps. Any questions about cesareans, just ask in the course.